this week's episode, we have Bob. Welcome, Bob.
Thank you.
So, Bob, you have ulcerative colitis, and we treated it by treating your spine. What's up with that?
We did. I was extremely skeptical because I had heard of all the people that you were helping for probably about a year. I was on Humira, which of course was doctor prescribed, and I knew of all the side effects. Unfortunately, when the side effects came home to roost and I developed lymphoma, I knew I had to get off of it, and that's when I reached out to you. And it's been 6 months, I believe, at this point.
Somewhere around there.
You've given me the exercises I need to perform, and I have been...
Targeted at your spine, right?
It's all on my spine, correct.
I got some asshole on Instagram saying I'm giving people running and walking to...
No, this is 100%. Anybody at home can do these exercises, all targeted at the spinal area that is for ulcerative colitis.
Yeah, that would innervate your intestines and stuff like that. So to kind of go back, so Bob, me and you have known each other for, I think it's about 8 years now, right?
Probably, yeah.
Met from some other accident trauma that you had.
Correct.
But I've known that you've had ulcerative colitis pretty much this entire time. I started getting this thought process of, hey, a lot of people with these GI symptoms actually have an underlying spine issue, and that's causing it. It started that around maybe 5 years ago, but we didn't do anything about it. And I talk a lot about not trying to treat your friends and family. It just doesn't go well.
Correct.
And you were doing pretty good on your Humira. Like, your symptoms were pretty well managed for ulcerative colitis.
They were, and the irony that brought me to believe this was working is that I've had multiple auto accidents throughout my life. So at 20 years old, I was a victim of a head-on car accident. I literally have 9 bulging/herniated discs.
You were in a coma for a while.
Yes.
Yeah.
And you were the only physical therapist that I found in my accident in 2018 when I herniated another disc and had some disc fragments that treated the pain out of the spine. Every other, and I've lived all over the country, physical therapist was always do these exercises, strengthen this muscle around it.
Yeah.
Correct.
Yeah.
So that's where a few years into that therapy that you helped me overcome, and I've been pain-free since, you were getting into this, treating the spine for all the other ailments.
Yeah.
And it wasn't until it really came home to roost for me that I reached back out and said, oh my God, I really need your help. And I have now 6 months in, 100% symptom-free.
Which is awesome.
It's so awesome that even, because I literally just finished radiation treatments for the cancer that I believe Humira caused, during that, I don't know, what did I have, 6 weeks of treatment where I was really just down and out. Any symptom that may have started, I just got that weight, started to do those exercises you gave me.
The modified Jefferson curl.
And it was done, it was gone.
Yeah.
I still can't believe that.
How long did it take for you to see changes when we started working together?
They were almost instant.
I've had a lot of people say that. I don't think it's the norm. It's not the norm yet. I'm not expecting that, but I think within 2 to 3 weeks, I expect to see some changes for most people.
Now the irony, as we got into your regimen and you kept adding additional exercises for me, the one where you're doing the sit-ups with the pelvic tilt, that the very next day caused like a massive symptom. And then within, I don't know, an hour or two after doing the full regimen of exercise, it all went away.
Yeah, and definitely see that. I kind of explain it to people where the whole point of what we're doing is, the spine houses your nervous system. The nerves emerge from there and they go all throughout your body. They innervate, your skin, your muscles, your joints, your tendons, your fascia, your intestines, your organs. If the signal's not getting there, wherever it's going, if it's diminished at all, you're going to get either symptoms or decreased function. And symptoms or decreased function in the GI tract leads to a lot of these problems. A lot of pain, diarrhea, bloating, constipation, pretty much anything that you would see with the diagnosis of, any IBS, IBD, Crohn's, ulcerative colitis, stuff like that. Well, if you do start turning that signal back on, Now you think like, all right, the intestines are now contracting properly, and all of a sudden, like the waste that's been sitting there is gonna move. And you get a lot of patients that they'll see that for about a day or two, and then it almost seems like they were, for lack of a better term, like cleared out.
Yep. Now the real irony, I went back to my GI doctor, and of course he wants to change me now and put me on Entyvio. And I'm extremely cautious, because any drug you put in your body has an adverse reaction versus to the benefit you're going to receive.
Sure.
I told him I'd rather stick with this regimen of just exercises and no medication intervention.
What'd he say?
He said, well, I would much rather you not get to the point where you have a flare-up and your bowels become so inflamed that it'll be too hard to get it under control. So we made a compromise. The compromise, I'm due for my colonoscopy anyway. We're going to have a colonoscopy in mid-December. He's going to give me the baseline as to how all of my organs are functioning, what kind of inflammation I might have.
Yeah, inflammatory markers,
correct,
stuff like that, yeah.
And I'm going to, it's my belief that I haven't felt this good for 6 months on 0 medication, and I can't tell you how long. I don't know how or any reason why I would want to even veer down that path.
And I'll get to this point a lot with patients, and they'll kind of ask me this question, and I don't like to, I don't guide people on medication. You know, I can help them with some of their thought process, but ultimately I'll say, well, what are you hoping the medication does?
Correct.
And if you're like, well,
the same thing I feel now.
Right, then okay, you know.
Right, but again, if I go on that medication, it's a self-fulfilling prophecy. I'm on it for life.
Right. How long were you on Humira for?
I was on Humira for roughly 3 years.
Did you, and straight, did you ever come off of it, or?
Never.
Okay.
And that was the issue. I had some pretty big side effects. Originally, the first month or so, great. All of my symptoms cleaned right out. I felt wonderful. I could eat again. Over a 12-month period, I put on about 25 pounds. It was, I thought, a great thing for me, which is why I was more trepidatious to join your thought process.
Sure.
Because I knew how bad I was.
Yeah, and I don't like to push it on people. You know, I'm out here talking about it, and because I see it, right?
Correct. Correct.
But I also don't, like, these symptoms can be life-threatening, if not at the very least life-changing. I mean, it changes, you know, where I go out to eat,
Yes.
how long of a car ride I'm willing to, how long of a movie I'm willing to sit through, you know, stuff like that. Like the stuff that you don't really think about, how close I can be to, or how far away I can be from a bathroom, you know. So I understand it with people why it's so important to properly manage this condition, but the problem is that all of the quote-unquote treatments out there aren't treating the problem, they're just managing your symptoms. And
correct.
For a lot of people, and the reason I really hesitated to bring it up with you, A, you know, friends, and I don't want to push that, but B, you said your symptoms were very well managed through Humira, and you're like, okay, well,
correct.
fine.
And I think that was part of the reason why when I got my diagnosis, I'm like, I'm just an ass. I was more scared to go back and revert into the constant pain, diarrhea, could barely eat, was losing weight, thought process of, well, if I change, who knows what could happen, and if you read the package insert for Humira and all these other problems, and I already had a fight with the insurance company that my original drug of choice, doctor wanted Entyvio, but insurance wouldn't cover it. And Entyvio has no possible lymphoma issues.
Correlation, yeah.
Correct, whereas Humira did. Now I have it, I'm stuck where I am. The piece that I cherish the relationship that we've built is that my body is just a mess, and as the colitis has been calm, of course I have pain in my left elbow. And I call you for it, and I come over, and we have a session, and you treat my spine, and guess what? The pain's gone.
Yeah.
So everything we've done since 2018 has been completely spine-related, and I have changed my thought process for physical therapy, I think forever, because every time you would either palpitate any one of the facets in my spine, I'm like, oh, yep, that hurts. And you're like, well, yeah, look at that. Now feel your elbow, or feel your back, or feel your leg, or you were able to correct that issue.
Yeah.
And it was all from the spine.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session But if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
And it's interesting. It's actually kind of annoying at this point because I seem very unilateral in my vision, but that's not the case. The reason I found this was because I've tried so many things out there, and
right.
because you're right, the normal treatment for anybody with elbow pain is treat the elbow.
Correct.
Anybody with leg pain is treat the leg. Anybody with a spine issue is treat around the spine.
Correct.
Protect it, don't mobilize it. Do some light, gentle strengthening exercises, very light movement exercises. And I did all that, and it just didn't work. And even with the elbow, people would come in with, we'll call it, you say tendonitis or tennis elbow or whatever, right? And sometimes it would work, sometimes it wouldn't. Sometimes they'd get a little bit better and then they'd stall. Sometimes they get a lot better and they'd stall. Sometimes the exact same treatment that I would do for the exact same symptoms on one person didn't work for the other. And you're like, well, what's going on?
Right.
And the more that I looked, the more that I kind of found the spine and looked towards the spine, the better I was able to get patients for a whole host of symptoms. And then kind of by fluke, that included GI issues. And then I started exploring that, and it was like, oh shit, this is more common than I would have thought.
Right. Well, I never expected it because so I had my original accident in 1992, moved around the country for a while, and I was in physical therapy for, probably 10 to 12 years worth, just because of all the reoccurring pain that I had.
Sure.
That every physical therapist in New Jersey or in Connecticut or up in Boston or Florida, wherever I was, would just treat around it.
I'll do the same stuff.
And then when the pain went away, eventually it would all come back because the muscles would either atrophy or I just was getting busy with work and couldn't keep up with my gym routine or whatever it was. And the irony when I met you, and we had a couple things going on, like we had the disc fragment that had to get absorbed, and that took place, and then you helped me get from A to B, and I've been pain-free on the lower spine, so much so that you actually got me back on the slopes to ski again.
Yeah, it's funny, the first thing I asked you, what would mean like you're better? And you said ski, but I'll never ski again.
Right.
And then you went down a Black Diamond?
I did, actually. I've been skiing for 3 years. I've taken my nieces and nephews. Some of them have never been skiing, and now it's a family tradition.
Back to the ulcerative colitis, when were you diagnosed? How long ago?
So I was diagnosed in probably 2005.
Okay, so about 20 years ago.
Yes.
How were you diagnosed?
So I had massive cramping, and I couldn't even get out of bed. I could barely eat. I went to a GI specialist who, we did a colonoscopy. She had originally said I had Crohn's and then downgraded me to UC, put me on a drug called Lialda without telling me any of the side effects. I was on Lialda for probably 5.5 years until it started ruining my kidneys. It started to shut down my kidneys, and unbeknownst to me, I didn't realize that was one of the side effects.
Okay.
So I was on blood work every 6 months, and that was why. So now I can no longer take an NSAID because it will ruin the rest of my kidneys, and I'm technically in stage 2 kidney failure, is what they deem me to be. So that'll be another thing I'd love to maybe get the process started with you to see if we can help pull that back. But after they told me, all right, I had to go on Humira, I said, there's no way. Just look at the side effects. So for another 5 years, I managed it with either diet or exercise until my body just rebelled so much. I wasn't retaining any of the vitamins anymore. I think I lost 20 pounds. I couldn't keep anything going, and I just had to go on Humira. I mean, I did the medical marijuana. I waited in Pennsylvania. I got on medical marijuana. That helped for about a year, and then the body just said, okay, we're good with this now, and it started to go downhill again.
Yeah, and That path is, I'd say, what 90% of the people that find me have been through something like that.
Right.
You know, first diagnosed, normally they've gone to multiple different GI specialists.
Correct.
They've normally traveled out of state or to, you know, some I don't know, some larger institute to confirm or rule out the diagnosis. They've been on multiple biologics. They've done multiple prednisone, steroids. They've been hospitalized. They're still having symptoms. Their symptoms are being managed. I'd say for you, your symptoms were actually better managed than most of the people that I come across.
Well, I was also off and on prednisone for quite a while.
Okay.
And it was, the GI guy had me on a 1 milligram daily dose just to keep me calm. And when I read everything about prednisone,
you can't be on prednisone for too long.
Well, he had me on it for a year.
Yeah.
And when I'm reading all these pieces, I'm saying to myself, this is insanity. The thing that I wished I had known or could have unprogrammed my brain, that more holistic or spinal treatment is the first way to go.
Sure.
Not take these drugs because that's what we were programmed to have as a kid.
But I get so many people out there too saying like, what I'm saying is dangerous. Like you're going to hurt somebody. You shouldn't be saying this. You're out of your scope. Stuff like that. I'm like, well, number one, I'm working on the spine. I'm very much within my scope. I'm a literal expert in it. Number two, how is saying, hey, before you start these strong, life-changing, biologics that you either can't come off of or won't come off of.
Correct.
So either way, you're not coming off of them, right? And if you do come off them, it's temporary, and then you're going to go back onto a different one.
Correct.
They're going to tell you that it stopped working, or you need to go on a higher dosage, or now you need to go from Humira to Entyvio to Skyrizi to Stelara, whatever, right? How is saying, look, spend 2 to 3 weeks messing with your spine. If it changes your symptoms, maybe spend a little bit longer, see if we can at least help address your symptoms. If not, get to the actual root cause.
Correct. And the irony is, I would say to anybody that thinks in that direction that it's harmful, I believe chiropractic treatment is probably much more harmful than any treatment that you're actually targeting a specific region of the spine to. I mean, the only thing you've really done was help me decompress any of the joints that I had to let blood flow get to where it needs to be. That's all we've really ever done.
You have 4 total movements, right? In your back. 4 movements. And honestly, it's like, that's kind of the more complete, but like 1 or 2 of them over the course of 2 or 3 weeks, try it. If it changes your symptoms, great. Right. Then you might not need life-altering medication.
Well, and the testimony I can give you to that, when I met you for my lower lumbar spinal herniation, I was having shooting pains in my feet, my tingling in my feet, my leg pain. When you treated my spine, and then you gave me exercises to do at home in between our treatments, all those pains went away.
Yeah.
And that was the first indication that it obviously works. So then as we kept getting down this path, the Humira aspect of it, now that I just use your regimen, I mean, I can continue to document how many months I am symptom-free, and then I can utilize the colonoscopy as really affirmation that, look, it continues to work.
Yeah, I'm surprised. Are they going to do a blood test too?
I get the blood before I get the colonoscopy.
Okay.
I get blood on a regular basis because of that Humira. But now I'm also a cancer survivor. December will be the true test. I have my PET follow up to make sure it's gone. But I have blood work now throughout, probably every 6 months just to verify.
Well, and for what you're going through, so for the people, just to kind of make it clear, you had to come off of your Humira because of the cancer diagnosis and the subsequent treatment. And that was about 8 months ago when that was found and said and kind of came to be?
Yeah, so I found the lump. Thank God I found it in stage 1. I went to my doctor in January. It was a fill-in, sent me for an ultrasound, said, well, we have lumps, it should go away. And then when my doctor came back in March, we did it again and said, I don't like that lump, let's get it biopsied. Yeah. So then it became, well, now that we know it is cancer, then you get the PET and then you get the bone marrow and the whole nine. It's so overwhelming oh shit moment.
Sure.
Like, because you go for the biopsy, and of course the doctor's bedside manner is probably not the best when it comes to calming natures.
No.
Because he said, well, look, just so you're aware, 50% of the time these are cancer. We could have waited for the diagnosis. Then I go through the PET scan, and of course the lump is only in my neck, which is great, stage 1, and of course the doctor then says, well, we have to do a bone marrow biopsy, because if it's in your bone marrow, it's stage 4. Well, you could have just waited. So here, of course, I get all the tests, and it's not in my bone marrow, and everything's fine, and we do this new proton radiation. I did 3 weeks of that, and the tumor is still shrinking. It should be gone by December, but without your treatments, I'd be on Entyvio as we speak.
Well, and kind of too, one of the points that I was making was, you've been through a bunch of shit. You know, a lot of people will give stress the underlying cause. You've been through an excessive amount of stress in the last 8 months.
Fair.
You've also been through a lot of testing and appointments, and so it's a lot of travel and sitting and different positions, and then you've even been through radiation.
Yep.
And during that time, you had to come off of your Humira cold turkey.
Yes, I couldn't even wean myself.
So your symptoms should have been,
Oh, that's fair. Flared up here and there.
Ironically, they should have been crap, right? Like, yeah.
I didn't even think of it that way, but yeah, only because, you know, I have this beautiful dumbbell now in my family room, but at night while I'm watching television, I'm like, why am I going to sit on the couch? No, let me make sure my body stays right. And I easily just do 15 minutes worth of your regimen to make sure that none of these symptoms come back.
Well, and how long does it take a day to do what I'm coaching you through?
So, and I'll be totally honest, certain days I'll do it 3 times a day just to make sure that I stay completely symptom-free.
I'd say at the beginning, I normally tell people twice a day, and then a little like here and there throughout the day. But you know, at the beginning, if it's been a long time, and you know, 3 times a day would probably be better. It's just compliancy and stuff like that.
Correct. So, I mean, thankfully, I own multiple businesses. I work out of my house. I have that ability. So in the morning, I'll do it. In the afternoon, I'll just get up out of my chair and do it. And then at night, while I'm watching TV, I just do it again. So, but on a regular basis, I'm probably twice a day.
What do you think time? What do you think time-wise?
If I spend 15 minutes, maybe it's anywhere from 10 to 15 minutes
each time.
Yes, each time.
Yeah,
and that's it.
And that's about what I shoot for.
Yeah,
I shoot for like a 15-minute max.
And it's not even strenuous. Yeah. If it were like a workout, when you get back and you're solidly sweating and you need to shower, none of that comes into play here. Yeah, this is just slow, controlled, easy. You call it exercises. To me, it's really like a stretch.
Yeah, I've been writing movement.
That's a better way to put it.
Yeah.
Because to me, exercise is going to the gym and pumping iron. Is again, that's how you're trained as a kid to exercise. Get out, you know, play 60 or whatever the government was pushing us at and all that good stuff.
Play 60.
Right. Well, this is really, everyone should probably be stretching just daily because of your activity throughout the day.
Well, and it's pretty easy to boil it down too. Your upper back needs to extend back because we're so hunched.
Right.
Your lower back probably needs to flex, bend forward. And there's a bunch of reasons for it, but if you do those 2 things, that's the majority of your spine, you're pretty healthy. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show. And that's the type of stuff that I'm trying to get out there. That's the type of information, and it's frustrating.
Well, had I had this knowledge of, or I should say, had I come across you decades ago instead of going to all these different physical therapists, it took me a bit of a mind struggle to let all that go, because yes, I would get out of pain, and I just thought because my body was so badly damaged, it's just the way that I am. And then when I started to get into your regimen, and I would do the at-home exercises that you made sure to give me because I would only see you once a week. Well, in the beginning, it was probably 3 times a week. It was that bad. But as we wean myself away, because again, it's a cost structure, I'm like, wow, I'm still out of pain. So if we could just get out of the mindset that you need to have what modern medicine says with exercise here, no, treat the spine. In my view, everything you've done treating my spine, every single time has given pain relief. Whether it be in the beginning when we met, the pain relief was maybe 3 hours. It was still pain relief that I never got through any other regular physical therapist with strength training around that spot.
Yeah. Well, and to be fair too, it took me almost 2 decades to get to this point of 2 decades of constant troubleshooting and training and weekend courses and specialty degrees and stuff like that, trying to find better treatment methods. And when we first met, I was still probably doing more of it was different, but it was still more traditional. You know?
Yeah, fair.
And then
because I was still doing, or you would give me the spinal manipulations, and then I was doing all the other exercises.
A lot of it, we were doing planks.
Yep.
Probably bird dog and stuff like that, side planks. And
well, the piece that I really know that it gets to work is that when I called you, I don't know, a couple months back about just elbow pain, you were like, well, it's not your elbow, it's your neck. And I came in and you did the manipulations on my neck, and I'm like, nah way, it was gone. All the pain was gone. And then you provided me with the apparatus to do the exercises that I do here at home that are super simple. It's the head harness that when I travel for work, I just pack it in my suitcase.
Yeah.
I mean, it's insane at how easy these exercises are, or stretches as they call them. You can do them anywhere, and everything you gave me for the colitis, for my elbow, for my low back, I'm able to keep myself out of pain anytime I go anywhere.
Which again is the goal, right? The goal is to get you to the point where you're not just better, but you'll stay better.
Correct.
And that's something that for a long time I was failing at with my patients. And again, you just had the mindset that everything that you do, I started to look at all the treatments that you get. And I mean, so it's your hot pack, your ultrasound, your TENS unit, your massage, your like your gentle stretching, your gentle strengthening, your laser, your trigger point, your Graston, your acupuncture, dry needling, whatever, right? Like,
I did everything except for acupuncture and dry needling.
And I've been through that myself and with patients, right? And so and all the stuff that I'm saying I don't use now and I'm saying not to use, I used for years. Cupping, just any traction, all this stuff. And then I started looking at it with like kind of a different viewpoint, a different light. And I'm like, oh, all this stuff is just temporary. All this stuff is just palliative. It makes you feel better in the moment, but it rarely lasts more than a week, if not a few hours.
Well, and call me cynical, but I own a wealth management company. There's no money in that.
Right.
And that's part of the issue from just my perspective on the healthcare in our country. We are the only country that looks at health insurance as a for-profit entity. And if it's a palliative, then guess what? You make money forever. If in your case, it's not curative, however, the spinal treatments that you provide and then you give these exercises at home, I don't need to come back to you.
Right, which would suck for business.
Correct. It's the exact opposite of what our country dictates as the money-making, just GDP growing engine in our nation.
Well, and it's ironic too, because I get so many people online that are saying like I'm out for money and stuff like that. And
you're the direct opposite. When I first met you, I was giving you tons of money because you were treating me kind of the older way.
It was spinal. You were a great patient at the beginning, 3 times a week. Like, so I own a practice with 5 locations, right? Like, you want those patients that are 3 times a week. The total knees, the total hips, shoulder patients are great, right? Somebody that had in a car accident, somebody that their doctor told them 3 times a week and they've had chronic pain, great. With good insurance, those are the ones you want.
And that was me.
Yeah, and now I'm like, all right, I'm going to see you once a week. We're going to progress your stuff, So I don't see you as much. And part of it too is like time, right? Like 3 times a week. You had to drive 20 minutes to the clinic, right? You're there for an hour 15. You had to drive home. That's 2 hours of your time, 3 times a week. That's a lot.
It was rough. I mean, I was fortunate that your clinic was open at 7 a.m.
Yeah.
And I was the first patient in.
But still, it
was a lot.
It's a lot.
And that probably didn't help the ulcerative colitis.
Right.
Because I had to manage the company, I had to manage the pain that I had from the original accident, and I think that's what probably sparked off me needing Humira, because my body eventually just said, look, I can't handle any more. I'm not absorbing any of the nutrients now. You're going to lose weight because your colitis is completely exacerbated with all the other pain you got to deal with. And then the stress of how do you manage multiple companies. It's just me. I'm a solo practitioner. So it was a lot.
Yeah. No, it is. And not knowing what to do and not knowing what the real cause is and not knowing what the treatment is, it's very frustrating. And the amount of differing information that you get out there is abundant, right?
Now, the real irony of the opposite of our growth engine in this country is that the more you treated me through the spine, the less I needed to see you,
right.
The better my life was, the more referrals I kept sending you, because I'm now one of the probably strongest believers of treating the spine. Really, like your book, The Spinal Truth actually does what it says it's supposed to or is intended to do. And for anybody that doesn't believe it, the worst thing you should do is try it.
Yeah. Well, and in your typical therapy, for the most part, you go there and they say, all right, 4 to 6, 6 to 8 weeks, and then we'll reevaluate, and people are going to get upset. The PTs out there are going to get upset, but that's the large majority. And you're just kind of hoping it goes away over time.
Well, you know why that 4 to 6 reevaluate is because that's all insurance will cover.
Yeah, absolutely.
It's not the patient. It's how much will insurance pay for, and they'll pay for 4 to 6 or even 8 weeks.
Before you have to do a reevaluation.
Right, you need an independent
assessment.
medical examination. Yeah. I've gone through all, the real irony is my original accident in '92 was in New Jersey. I was the victim of a head-on car accident. I was cut off, I can't tell you how many times, from care. The first time that my insurance company cut me off, the very next week, an orthopedic surgeon said I needed to have my PCL replaced. It was so badly damaged. So insurance is just a fight that you can easily overcome. Ironically, I wrote a book on how to get what you need from your insurance company without an attorney, because it took 31 years of me fighting them, but I fully exhausted that coverage. 31 years later, I used $250,000 from the original car accident.
Wow.
So in my view, insurance would benefit by using your services.
Sure.
They're going to pay a lot less. They're going to get a much better outcome. And then honestly, in my case, like when my colitis might start to flare up ever, I'll just go do your exercises first and not say, oh, I got to get in there and pay another copay or have you fix me. No, right. Let me try what you're going to have me do anyway.
Right, and I send you the videos.
Yes.
So you have them at home to refer to. And now when I'm treating somebody, if I'm treating them for 4 weeks and they're not at least 25% better,
they're probably not doing the exercise at home.
Yeah, or I'm upset about it. Like I'm frustrated, and now I'm starting to troubleshoot. Now so like the point was, like I went from that model of, all right, we're going to give it 4 to 6 weeks. We're going to do some strengthening over time, and we this is a process, to expecting relatively immediate results, and that's something out there that I never saw. Outside of McKenzie physical therapy, I never saw that in physical therapy, ever. And I think, like you said, you've been to Jersey and Florida, and
I've been all over.
Did any place expect changes that visit?
Never.
Never.
They
right?
all would tell me this could take 4 to 8 weeks for your body to build up the muscle it needs around that area to keep it stable.
Right. And I believe that too, and I practice like that, and now I think that's bullshit.
Well, I would probably relate it back to, if you can get the pain removed immediately, it gives much more credence to, all right, now I'm going back to the gym because I'm in less pain. So the muscle stabilization around it becomes easier because you pull that pain factor out.
Well, and people don't realize too, pain shuts off a local area. Like if you have knee pain, you are weaker in your knee. Yeah. Pain, like I always give the example, like if you break your arm and like you have bones sticking through, right? Like your body protects it, because if you were able to contract that muscle, you might rip that jagged bone through, tendons, arteries, veins, nerves, stuff that you absolutely don't want to rip it through. So like you can't because of pain, and to a smaller degree, that's what happens with back pain, and that's what happens with shoulder pain, is that those muscles shut down. And then what we do as a society is we try to work on those muscles where to strengthen them, but the muscles didn't shut down because they're weak. They're weak because of the pain. They shut down because of the pain.
Protecting the body.
Right. So if you can fix that, if you can turn the nerve signal back on, if you can take the pain away, now all of a sudden it's so much easier to contract that muscle, and now you're actually successful in your strength training.
Exactly right. And I think it came glaringly obvious to me after the, I don't know, damn near a decade of working with you, that when I went to you for my elbow pain and you're just like, just lay down, it's coming directly out of your neck. You would press on a couple of areas in my neck area and I'd almost want to jump off the table. Like, how did you know that area? Well, I think you've been doing it long enough that you have figured out exactly what section is radiating pain down to one area. And by the time I got off that table, my elbow pain was completely gone. You gave me a new understanding of the nerves and how nerve endings actually help with strengthening in a specific area, that every time we would do the meters and I'd check the strength there, I'm like, wait.
Yeah, your strength goes up.
Oh,
immediately.
And all you did was manipulate the spine.
Yeah.
That was it. That was when I became the true believer that, yes, all of these aspects that you're manipulating within the spine absolutely relate to every part of every movement you make in your body.
And again, it's something that it's not something I was taught per se. It's not something that like I was pigeonholed into, or I kind of came about it, so to speak, honestly, over the years of failing to provide better treatment for my patients and myself, my own health issues.
Well, I think you went from more of a Me Too physical therapist to a complete disruptor. And I think the more we can get this type of therapy out there, the better everyone is going to feel at a lower cost, at no prescription drugs that you need to try first, that all have a detriment. It's, why wouldn't you try this as the first point of contact?
Right, and I like the way you phrase that too, because for the people out there like, oh, this is dangerous and stuff, like, hey, if this doesn't work, you still have your drugs to take. You still have the medications, the injections. I'm telling you, give it 2 to 3 weeks. Give it 2 to 3 weeks of just following what I say. If it's working, great, stick with it. If not, write a bad review and go get your medication.
Correct.
You know, whatever. Great.
But there's no downside to it, other than you'll save money, and you could save whatever organ the detriment of whatever the medication may or may not do to your body. And trust me, I found that out the hard way.
Yeah, no, it's really frustrating. So what are you expecting on your upcoming colonoscopy blood test? So you know what were your previous findings in your, like, before we started this?
Yep.
What were your previous findings on your colonoscopy and your blood test?
So soon to be 54. Usually your colonoscopies are every 5 years. Mine are every other year now.
Aren't you lucky?
I'm so lucky, it's insane. So my last one was 2 years ago. And because I was on Humira, it was great. Everything was healing. It looked really well. So I'm going to match this one up against that one. And if it continues to get better and better and better, then it's obvious this is working.
Sure.
Because, I mean, I'm a solid 10 months before, I should say 10 months, no Humira, and before the colonoscopy. And if within 10 months, something wouldn't have reverted back if I wasn't using your techniques, obviously it'll be shown on that colonoscopy.
Yeah, you would think, and you're going to get people out there like, oh, there's remission, and you have been through a lot medically. So there are some confounding factors here that throw a little bit of a what if in the works. So this does need to be studied over time, and we are trying to get your information into your case study into a study.
Yep.
Right? So we're trying to do that. And this does need to be studied over time, but the whole point is that it's not just you. You've met people that have come to me for your similar symptoms, Crohn's or ulcerative colitis, and they've had the same response too.
Right.
And I'd say for the people that seek me, normally they're the ones that they're not responding at least fully to the medication. they start to hear about me talking about back pain and some history and like, oh, I had that, and they're more likely to not be controlled by medication. They're more, or their symptoms, they're more likely to have had some back pain. So it puts them more likely that an underlying back issue was the problem. I'd say about 60% of the time you get significant or total relief of symptoms.
I think the best testimonial that I can give you is that over the last 8 years we've been working together. First, when you sat down with me on the original meeting, it was, all right, what would be your end result if I could make you feel better than anything? And the skiing part was one of it. So all those years you've been treating me, prior to that, I would feel okay. But since I started with you, I feel well enough that I'm back at the gym on a regular basis. I'm putting up more weight than I've been putting up for the last 20 years. I started skiing again. And I just, if I have one minor little tweak in my body because I'm sitting all day, I just use the techniques you gave me. The pain's gone. I'm not now 3 days into this, say, oh, I need to go get a heating pad, or I got to put my feet up, and I got to, all that in my life has been gone since I just utilized the simple stretching techniques that you give me.
Was there any adjustment period when and maybe now talking specifically for your we'll call it your mid to lower back for the ulcerative colitis, when we started doing this program, was there an adjustment period where you were like, I'm in pain, I'm sore, or you're not sure it's going to work?
So the adjustment period was probably I got sore because I'm using dumbbells, and you had me do exercises that my body hadn't done before. So it was whatever those minor muscles were around the low back. It was like gym soreness, just muscle. Nothing that I would say, oh, I hurt. It was, I was training muscles again.
And I would say because you had been working out, because you'd been active, you probably had less recourse than a lot of people do.
Yep,
a lot of people I treat are very sedentary. They're not going to the gym. I'd say a good amount of the people, 2 to 3 weeks, they are sore. It's heavy gym soreness. It's like you haven't been in the gym in a year or two.
So the third day is usually the worst?
Yeah, right. That like delayed onset muscle soreness. Like it's so the like day 3 to week 3, people are going through it.
Yep.
And I kind of expect that, and I tell people about that. But it does, the way you come in, if you've been physically active and stuff like that, it definitely mitigates that.
Well, and the other indicator I get, having crushed all 10 toes, 9 bulging herniation discs, cadaverous ligament in the right knee, I don't have the ability to get sedentary.
Were you ever told that you can't bend forward anymore?
No.
I don't have that?
Any, because my issue was I refused to have any spinal fusions.
Well, again, kind of talking about the comments that I get, and which reflect the common beliefs, right? Most people, they say, oh, with a hernia, I'll show the Jefferson curl bending forward with a weight, trying to flex your lower back, and they'll say, oh, that's a good way to blow out a disc. But you have blown out discs, right?
I have 9
blown
out discs.
And you're
And the exercises that you give me actually give me more range of motion,
right?
Not less.
How much weight are you using now with the bending forward?
So now I think I'm using 50 pounds.
Okay.
Just on the dumbbell. On the neck head harness you gave me, I'm up to a 40-pound band.
Resistance, nice, yeah. No,
and I feel great. That's the part I love about it.
Yeah. Yeah, and again, it's stuff that I've seen, and I've seen it for myself, and I've seen it for my patients, and it's the information I'm trying to get out there. I think there's a better way. I think the body can heal very well, but I do think that you need to do stuff in order to help it. And honestly, it comes down to, for a large majority of us, it's undoing the sedentary lifestyle that we have at the neck and upper back, and then and at the spine. So at the neck and upper back, and at the lower back. Just a few simple movements undoes all that sitting stress, all that, and then there you go, and then you're healthy.
The piece that I'm enjoying most about the treatments that I was able to get from you is that I'm at the gym now. My stamina's more. I'm doing more exercises because I'm in a lot less pain than I used to, which in my view just makes me stronger all around, and makes me drink more water. I just feel much healthier.
The ulcerative colitis, when you were on the Humira, were you still having symptoms, and were you still not able to like eat or drink certain things without having recourse?
Yes.
What were you not able to eat or drink? Or
so most dairy products, even on Humira, I couldn't even touch.
Okay.
So I couldn't really have cheese. Every now and again, I'd find myself a piece of maybe goat cheese because it wasn't cow milk. But it would still give me tons of gurgling.
Have you tried that since you've been off Humira and been doing the exercises? Have you?
Since your exercises, I eat regular cheese, I eat goat cheese.
Yeah?
Oh yeah, and I don't have anywhere close to the gurgling. If I feel like, and I would say that I would have a full-blown 24-hour episode on Humira, and I'm like, what did I eat?
If you ate cheese or?
I mean, sometimes I'm like, no, I would stay away from those foods. I think it was more just stress-induced.
Well, and I like to look at it for patients where the spine, specifically like this, they're quote unquote mobile. Mm-hmm. Okay, they can kind of herniate and then reduce. They can bulge and put pressure on a nerve. They can, depending on the position that you've been in, and so a lot of people will talk about remission, and for me, I actually think it makes more sense as a spine issue because symptoms are kind of on and off, and that's what I look for when you tell me elbow, right? So
right.
that's where I could be like a little, we'll say cocky about like it's your neck, And again, we're friends, so I'm speaking to you differently than I would a patient.
For sure.
But when you're like, yeah, like it's just there, and then like the other day it was fine, I'm like, oh, it's your neck. Like I look for that on and off. And for a lot of people out there, for their GI symptoms, they're on and off and they can't figure it out. They can't, they're like, no matter what diet I do, no matter what medication I take, no matter what I avoid, it like, sometimes I avoid dairy and I'm fine, and then I'm still avoiding dairy and then it pops back up. And you're like, yeah, because you're not looking at it for positionally. You're not looking at it for, you were just in an 8-hour car ride on like a bumpy road, or you just went running, and like, you're not looking at it to position your spine. And now when you start looking at it through that lens, it actually starts to make sense.
Well, and I think a lot of the knowledge that you've been kind enough to just share with me throughout the years is that, yeah, when I'm on a 8-hour car ride taking all my nieces and nephews to Canada skiing, or if I'm on a plane going out to the West Coast for work, when you get out, do these exercises, get your back into alignment where it needs to be. I do all those features, and then I'm good for the week.
And like what you said, you can pretty much travel with the equipment you need.
Yep.
And so all the stuff that I do, it's geared towards very minimal equipment, making sure that you can pretty much do what you need to do anywhere with almost nothing.
Well, the other piece I really do like about the techniques that you use, I mean, they can be taught over Zoom.
Right.
And the fact that, like during my radiation, the 5-6 weeks when I was kind of out of it, I had to go back to your videos. Like, not only did you give me the exercises here, but then you followed them up with instructional videos that I didn't have to say, oh, damn, I forgot what I had to do. Caleb, can I get another appointment so you can retrain me?
Right.
No, I just use the video.
And I don't want that because...
Well, correct. You're making less money.
Well, no, I mean, no. I mean, I don't want that. I don't want to see patients.
No, that's fair. That's fair.
I don't want to have to, especially for the same thing. Like I used to be okay with it. Again, when I'm running like a growing practice, and like that practice is for money. Like that practice is for profit, right? This is kind of more for I want to change the medical system. So Well, the
real irony, I think, the more you can get this to the mainstream, you're still going to make the same money. Because people are always going to be dumb and either have falls on the ice or do things, and you'll always see patients, but I think you're going to provide them with a much better outcome than anyone else out there, and they're going to flood you with more patients.
I used to always joke because somebody would be better, and I'm like, and they're like, I hope I never see you again. I'm like, I hope I never see you again for this issue. Like, I hope you get into like a nice, like a gentle skiing accident, and like you tear an ACL, and then we can see you for that. Like that'd be great.
Right.
But for the stuff I've already worked on, I never want to see you again because I want to have taken care of it, and I want to have shown you how to take care of it if it ever comes back. And the problem is that our medical system doesn't do that. By large and whole, and you're right, because it doesn't make money that way.
Correct.
So,
and then the one thing that I think drew me most to you is that you could tell you actually cared about the outcome, because every time I started and I was in so much pain, I'm like, look, I gotta get a pain injection. I can't take it. And you're like, well, can you just hold off for another 2 weeks? Let me see if I can just help you with this. And you would.
Yeah.
And it worked.
I would tell you to, hey, schedule it.
Yep.
Schedule it out. Give me a reasonable time, 2-3 weeks.
Yep.
it normally takes about that long to schedule anyway, unless like you're really pushing and, you know, but like if you're just calling up the doctor's office, it takes anywhere from like 3 to 6 weeks to get in and get an injection and whatever. So I said, schedule it, but give me that time and hopefully we can avoid it.
And I think most of it was due to that bone fragment that I had in that herniation, that until it got absorbed.
Yeah, and they used injections, right, to break that up.
They did, but I only needed 3.
Yeah.
It
was a disc fragment.
Correct.
Yeah.
Yep. So I mean, I can't say any bad things about it. I mean, just the idea to try it, A, can't hurt you, B, it's helped me tremendously, and C, I barely have to ever come back to see him except for, let's go for lunch or a beer.
Yeah, there you go. And that's the way all patients should be. Right? If you were going to leave somebody with, like, if they're having GI issues, if they've been told they've had IBS, IBD, ulcerative colitis, Crohn's, if you could leave them with like just a little bit of your experience and your recommendations, what would it be?
So the recommendation I would give you is that this should be your first course of action. Unfortunately, through my life, I didn't do enough homework. I now have stage 2 kidney failure from the first go-round of the medication that they try to treat my UC with. The second round, I developed follicular lymphoma because they put me on Humira, and that is 5% of patients if you read their package insert. If I'd have just started with this process, I can't say that I would have avoided any other issues, but I'm 99% sure in my mind that I would have not have developed any of those other medical conditions.
Well, and we'll update this over time. Like we said,
I say we can track this for a decade. Yeah, I'll give you every single colonoscopy just to see where it lies.
Man, do I have stuff to look forward to?
You and me both. I'm just a little pissed that it has to come every other year instead of every 5 years, but yes.
No, it should be tracked, right? I mean, it's at the point where it needs to be studied, and we're doing that. And that's,
well, I'm going to throw one more at you now.
All right.
I'm also on omeprazole for acid reflux.
Okay.
So I get an endoscopy at the same time I get a colonoscopy.
Okay.
I'd love to see if maybe we can work on keeping the acid reflux lower, and maybe I can get off omeprazole.
Yeah, I mean, it's definitely possible. We have that. That's a chapter in the book. That was some guy that we were treating for something else, and he's kind of bugging us on the visits because we're asking him about his hands, and he's talking about his acid reflux, and we're kind of like, all right, like, guy, like, this isn't what we're here for. And then he keeps talking about, and then he kind of had to like sit me down and like almost like hold my head and to, and it was over telehealth, so I'm, speaking, hypothetically, or he kind of had to like really show how much this had impacted him. Because when you hear acid reflux,
right.
Whatever, like you get some agita, after you have spaghetti sauce, and like maybe don't have spaghetti sauce at 8 o'clock at night and go to bed, or right. And I'm being a little flippant about it, but like he was getting ready to have esophageal surgery. He's like, no, this is like, I'm not. He was doing this weird like throat clearing kind of cough every like 30 seconds or so, and his wife was saying, hey, you're not doing this anymore, and he wasn't having all these other symptoms that. You don't realize that like fatigue and pain can come from chronic GERD, chronic reflux, and then again. So a lot of the stuff that I do, it was almost, we'll call it a mistake. It's just listening to the patients, what they're telling you, their symptoms, and then trying to like make it make sense. And then once we realized it, then we realized the area of the spine that would innervate the lower esophageal like. Sphincter, and there you go.
Yeah, I'd be very curious because, ironically, the reason why it happened to me, I wound up needing the Heimlich twice because acid reflux had just inflamed the lower esophagus and food couldn't get past.
Huh. Yeah, we'll have to look at that.
So yeah, I'd be curious to see if we can just keep adding more trials to your study.
Yeah. Well, so that's our show. Hopefully that you heard some new information, hopefully that we gave you a different way of looking at your body and your symptoms. If you or a friend or a family member has any of these, send this show to them. There's other episodes with other patients with ulcerative colitis and Crohn's and IBS issues and a whole medley of other conditions out there that you wouldn't think would be spinal related. And I found that they not just can be, but they often are. And that's the message that we're trying to get out there because a lot of times these are getting misdiagnosed and then mistreated in the medical system.
Yeah, I appreciate you helping me throughout this journey of my life, because it's been a whirlwind. And I look forward to just seeing what else we can do to keep me pain-free for the next 40 years.
And I'm excited to get colonoscopy results every other year. I can't wait.
Yeah, exactly.
All right, that's our shows. Stay tuned for next week. Make sure to like and follow us on Instagram, TikTok, Facebook, stuff like that.